Not that we need. Okay. Welcome, everybody. We're going to just give this a minute or two for some people to trickle in, and then we'll get started. Okay, all right. I think we'll get started. Thank you, everyone, for joining us tonight. My name is Chris Logan. I'm a research associate at the Shankle Clinic, and I will be facilitating this evening's presentation, as well as the Q&A section we'll have after the lecture. To start, I just want to share a few quick housekeeping items. Our session will start with a brief introduction by Dr. Shankle, and then our guest, Molly Rapozo, who we're so excited to have with us, will give a short presentation about brain health coaching. In the final 15 minutes, we'll open things up to the Q&A. If you have questions you'd like Dr. Shankle or Molly to address, please use the Q&A function in Zoom. You should have a button at the bottom of your screen you can click on and type a question that will come to me. I will then bring those up during the final 15 minutes in our Q&A section. I may not get to all of them, but we will try to get to as many as we can. Video and audio are disabled for attendees. So if you're shouting or waving at the computer or talking to someone nearby, have no fear, please. Know that we cannot hear you. If you have comments or questions, you can message me or use the Q&A feature. Lastly, we're going to post a recording of tonight's webinar on YouTube and on the Shankle Clinic's website in the coming weeks. So please stay tuned for that. And if you know anyone who wanted to attend tonight but couldn't make it, that's where they can find the recording. So that's it for administrative items. To start, I'll give a brief introduction of our host. First, Dr. William Shankle. Dr. Shankle is one of the country's leading experts in Alzheimer's and other age-related neurodegenerative conditions. He spent over 3 decades treating patients fighting these diseases, conducting research to advance our knowledge of the brain, and developing new treatments to delay or prevent the progression of cognitive impairment. In 1997, Dr. Shankle founded the Shankle Clinic, a neurology practice headquartered in Newport Beach, California, which is focused on the management and treatment of neurodegenerative conditions. Prior to founding the Shankle Clinic, Dr. Shankle served as the clinical director for the Alzheimer's Research Center at UC Irvine, which he co-founded. He also served as the director of Memory and Cognitive Disorders Program at Hoag Neurosciences Institute. Currently, in addition to leading the Shankle Clinic, Dr. Shankle serves as the Chief Medical Officer for Embic Corporation. He's a research associate with Hoag Memorial Hospital, and he's a clinical PI for a 5-year NIH grant with UCI. And our co-host tonight is Molly Rapozo, who we're so happy to have join us. She's a brain health coach at Pacific Neuroscience Institute. Molly Rapozo, MS, RDN, CD, became a registered dietitian nutritionist after receiving her master's degree and completing an internship at Bastyr University, a pioneer of science-based natural medicine. Before specializing in brain health coaching, Molly worked at a biotech startup that utilized genetics, blood analytes, gut microbiome, and digital self-measurements to help individuals reach their personal health goals. Based on this data and behavioral science, Molly used a personalized list of recommendations to coach participants in optimizing wellness and avoiding disease. Molly currently provides coaching for clinical research trials at the Pacific Brain Health Center at Pacific Neuroscience Institute, in addition to working with patients who receive treatment with medical specialists at the center. She brings years of experience counseling individuals and families in a number of settings, including community clinics, the YMCA, public health, and her local school district. An avid meal planner and cook, Molly enjoys teaching people how to make good nutrition easy to do and delicious to eat. She also provides support and accountability with sleep, stress management, and exercise. Tonight's presentation by Molly and Dr. Shankle is titled Optimizing Cognition Through Brain Health Coaching. If you'd like to get in touch with Molly about brain health coaching, I'm going to put her contact information in the chat below. So without further ado, I will go ahead and pass the reins to Dr. Shankle and Molly. Thank you all for joining us.
Oh. No, thank you. Let me see if I can make this thing work. Okay. Are you able to see the slide?
Yes.
Okay. So what I wanted to just do is provide a background on, there we go. The basis for the lifestyle interventions that we did as a clinical trial, FDA clinical trial, for looking at the value of lifestyle as a treatment for cognitive impairment due to Alzheimer's and other causes of cognitive impairment. And we recently published the results of the study in the Journal of Alzheimer's Disease in October of last year. I just give you a little background on this as a preface to what Molly Rapozo will talk about, who was the life coach for the COCO study, which stands for Coaching for Cognition Trial in Alzheimer's Disease, COCO. And I'm very excited about it because it was the treatment effect was actually larger than the newly approved drug for Alzheimer's disease, lecanemab. And it certainly doesn't have any of the side effects of lecanemab, which can be life-threatening. So the background of the COCO study was a 2-year trial where patients in the Shankle Clinic were randomized to either get lifestyle recommendations based on some international studies that showed the benefits of lifestyle interventions. And it compared that group, which we called the control group, to patients who also received lifestyle recommendations, but they had periodic meetings with a life coach who then helped kind of tailor the program to the individual, as well as monitor how well they were, complying with the recommendations. And the slide you see right now shows the results in cognition for the two groups. And the green arrow shows that over the 2 years, there was essentially no decline in the group who had the life coach. And in contrast, the group with the red arrow was the group that didn't have the life coach, but got the same lifestyle recommendations. So you can see there's quite a significant difference in outcome where the cognition did not decline in the people who engaged in the proper lifestyle. So the next slide shows even more interestingly that when you look at the metabolism of the brain and the body, that there are some major differences between the two groups. The largest protein in the blood, which is basically egg white or albumin, does a ton of different things for the body and brain, and it was quite different in the two groups. Something called an interleukin, which increases inflammation and associates with many inflammatory diseases, which was much lower in the group with the life coach. Another metabolic product, carnitine, which helps preserve kidney function, was at a much better level with the life coach group. And another molecule called hexadecane dioate, I just learned how to pronounce that one, is basically something that regulates calcium signals, which the calcium, if you don't know, is so important that the concentration inside the cell is 1 billion times lower than outside the cell, and calcium is used to control how the cell functions. So these are just some examples of the benefits of the proper lifestyle. In addition to that, there's also economic benefits. as a consequence of a not delayed, but stabilization of cognition over the study, we were able to look at the direct Medicare costs of the two treatment groups. You can see the green curve is the Shankle Clinic Plus Life Coach group, and their 5-year projected costs for direct Medicare costs were $40,000 approximately. The Shankle Clinic group without a life coach, their 5-year costs were approximately $53,000. And we also were able to compare the national standard of care. So if you go see a neurologist or a primary care doc, and they provide the dementia care or the cognitive impairment care, the average cost for that group was $84,000 over 5 years. So the combination of what we do at the Shankle Clinic plus a life coach cut those costs in half, and were exactly the same as people who don't have dementia, which is, to me, pretty amazing. So as a result of that, I signed up with Molly Rapozo, the life coach, and I lost 15 pounds already, and I'm feeling a hell of a lot better. So with that, I don't want to waste any more time and give the rest to Molly.
All right. Well, I have a few slides to share as well. So let me pull those up for you all. Thank you so much. I love that last slide. That's really impactful. So thanks for sharing that. All right. So my brief was really to explain, where I'm from, why people would want to do coaching, what's the efficacy around it, what am I coaching about? So hopefully I will answer all of those questions. If not, I'm happy to do so during the Q&A. So I am at the Brain Wellness and Lifestyle Program at the Pacific Neuroscience Institute Foundation in Santa Monica. However, the COCO trial was coached by phone. It was before, well, COVID happened in the middle there. But phone worked really well for people before COVID. Now I typically coach over Zoom, so we don't need to be in the same room for it to be effective. So at our lifestyle program at PNI is a mix of brain training and lifestyle coaching. Our objective is quality longevity, remaining healthy, mentally fit, and energetic throughout a long and productive life. And to achieve this, we focus on exercise, nutrition, sleep, cognitive training, and stimulation. I'm going to talk about this today as lifelong learning. I think we have the best research around that. Stress management and social engagement. So does health coaching work? Looking at the research, health coaching has demonstrated benefits in chronic disease management and lifestyle modification. Coaching has also been shown to support cognition for those at risk for Alzheimer's disease and related dementias, and individuals with mild cognitive impairment. And as you just heard, the COCO trial found that a remotely coached multimodal lifestyle intervention improved cognitive outcomes in participants with early stage Alzheimer's disease and related dementias. So we know it works. So I think when it comes down to coaching, why should people do it? A couple of the best benefits are support and accountability. So a good coach provides expertise in behavior change science and has knowledge of evidence-based recommendations that will give you the most bang for your buck. So one thing I really help people with is to come up with some interventions, some action items, I call them, that will get them towards their goal, that are reasonable to accomplish, that they're excited about doing. So this is really, coaching isn't, I'm not making edicts. I'm really working with you to figure out what's going to be the best fit for you, that's going to be really doable and give you some good results. So coaching facilitates educational and emotional support. It provides practical assistance, and it's really a time for self-awareness, especially in the face of some kind of scary information, some things that maybe you can't talk to everyone in your life about, or maybe your spouse is tired of hearing about, right? So this is really a time for you to be able to work through this. So this work can lead to improved health behaviors and outcomes. And I know Dr. Shankle was pretty interested in the behavior change piece, because that's most people, if we look at this, look at the evidence, most people have trouble changing. It's not an easy thing to do. So some of the ways that I like to work with people is to think about experiments in your life. Dietary changes can be really difficult, and it's hard to give up something before you have other things that you love to put in its place. So I really like for people to experiment with some new foods, to try some things before they make a radical change to their diet. So that's one way. Another way is to experiment with different behaviors. So if you think, oh, I'm going to have to go to bed at 10 p.m. every night for the rest of my life, that can just be really depressing. But what if you just experimented with that a few days a week? Is that something that you could do for 2 weeks until we meet again? So this is one way that I help people to build up some momentum and success and make it really doable for them. So now I want to go into these different areas and give you some of the science behind why I would pinpoint these things. So in terms of exercise and cognition, studies show that physical activity is one of the most important behaviors to prevent age-related decline and all forms of dementia. Aerobic exercise, resistance training, and multi-component training have all been associated with improvements in cognition, such as executive functions, memory, attention, and processing speed. So the multi-component, you may not have heard of that before. That's when you're doing an activity that takes a lot of cognition and also motor skills. So if you're doing something like playing ping pong or tennis, you need to react. That ball is coming at you. You can't anticipate that. We call this an open skill instead of closed. So this just takes a lot of cognition. It's a great training to do mentally and physically at the same time. I can share with you that I took up pickleball a couple of years ago, and it is a brain workout for me to figure out whose turn is it, what's the score, which side should I be on the court, and also, be sending those balls back. So if that's not something you're already doing, other modalities might be dance, Tai Chi, just something that takes a lot of cognition while you're doing it. So then we have the nutrition piece. So the standard American diet is high in saturated fat and sugar, which contribute to chronic disease, while also impairing cognitive functions through mechanisms like inflammation and changes in the gut microbiome. The Mediterranean diet, characterized by high consumption of plant foods, has been associated with lower rates of cognitive decline. In the COCO study, we recommended the MIND diet. This is a hybrid of Mediterranean and DASH, which is for lowering hypertension. And it also shows promise in preserving cognitive functions due to its anti-inflammatory foods. Sleep also has a big impact on how we age. So 7 to 8 hours of quality sleep overnight is essential for maintaining cognition, including memory, executive function, and emotional processing. Habitually getting too little sleep, less than 6 hours per night, is associated with reduced brain volume. Then we take a look at stress. So high levels of stress hormone cortisol have been shown to directly cause damage to the hippocampus, the brain's memory center. Apart from its direct effects on the brain, chronic stress increases the risk for heart disease, high blood pressure, inflammation, and other factors that increase your risk for cognitive decline. Lifelong learning is really important. Evidence suggests that engaging in learning activities throughout your lifetime can have a positive impact on your brain. Learning new things and fine-tuning what we already know supports our sensory and motor skills, memory consolidation, and our ability to recall information. For instance, learning a musical instrument or a new language at midlife is protective for brain health. And last up here, we have social health and cognition. Social connections and support are associated with better cognitive function and may protect against decline. In contrast, social isolation and loneliness correlate with poor cognitive outcomes and accelerated loss. In addition, social health may influence cognitive reserve. That's the brain's resilience to damage. Higher levels of social engagement might contribute to a larger reserve, thereby providing protection against dementia. So I have a whole team at the Lifestyle Program. We're experts in brain wellness and lifestyle behaviors to support quality, longevity, and cognition. We specialize in neuropsychology, geropsychology, cognitive training, exercise, and nutrition. We're currently offering classes and individual sessions on site in Santa Monica or virtually. So I have a free series that I'm doing. It's been grant funded this month, and I have 2 more. It's on Wednesdays at 11. So I'd love to have anyone join me with that. In terms of our programming, we provide education and support for individuals and families looking to optimize their brain health and address memory concerns or cognitive changes. So one of our programs, Vital Minds, I often recommend to people who might not be as interested in coaching. So group offerings are less expensive. So that might be a reason you might also want to be in a group. So we have a series called Vital Minds that combines brain health education with memory techniques and cognitive training. Ryan, our activity expert, has Fit Brain sessions that he offers, and this is dual task exercise. Of course, I provide health coaching, and we have individualized consults and planning in terms of memory concerns with our psychologist, Dr. Karen Miller, and we provide memory care as well as caregiver support groups. And here is our card. So this number is a bit different, an email than what was in the chat. This goes to our program coordinator. So if you would like to contact me directly, you're more than welcome to do so.
So that
Thanks, Molly.
well, Molly, that PNIF Brain and Wellness program, is that a group program?
So we have group and individual programming at the Brain Wellness and Lifestyle Center, I guess.
I see. Okay.
Yeah.
Mm-hmm. I also saw you had a Fit Brain program. Is that using some sort of Fitbit device?
No, it's actually, we have a gym. It's a Fit Brain gym. And you can think of it as exergames. So I don't know if anyone's played Dance Dance Revolution, but you can kind of think of that. Basically, it's going to have you do a cognitive task while you also are being physically active. So there are actual like game boards that people interact with. And it is something that he is able to do that virtually as well.
Oh, wow.
Mm-hmm.
Exergames?
Exergames. I mean, he's an expert in exergames, but it's Fit Brain is what he calls it. If we have anyone in the Santa Monica area, he also does a group called Memory Marathon, which includes some brain health education as well as some of the Fit Brain gym time.
So this is something you could learn about and then access the online tools and do the workout? Is that the idea?
You probably need to get in touch with him. He does do consults. So he will do this with people in their home, through Zoom. There's also a gym that people can come down and do it. And actually, he just started a service where he will help you set up your own Fit Brain gym in your home.
I see. So would it be the kind of thing that, what's that, Peloton? Is that how you pronounce it? Peloton?
Yeah, Peloton, but on a smaller scale if you were just working with him. He does do some virtual groups, but not as often in the group format, unless his group wants to do it virtually. I mean, he can do that. It's possible.
But that would be
Do
something
you,
you do with him as opposed to doing it on your own after you learn it?
Well, you need the equipment. That's part of it.
Got it. Okay.
well,
Yeah.
Dr. Shankle, do you mind if I just jump in? I would love to hear your thoughts on, why do diet and exercise, like what is the impact on the brain? Why would being in a less inflammatory state improve someone's cognition or change the rate of their decline?
Well, I suspect that Molly may know a lot more than I do, but one of the things about diet is that certain foods can produce a lot of inflammation. And whenever there's inflammation, it's basically signals to cells that can damage cells and damage the proteins in the cells. Whenever there's damage to the proteins in a cell, the proteins provide the functions of a cell. There's about 100,000 different proteins in each cell. And if a protein gets damaged, it gets repaired. There's two different systems to repair proteins in cells. That's fine as long as the cell's capacity to repair the damage can keep up with the damage. So the more inflammation, the more damage, the more repair. But if the ability of the cell to repair, if that ability gets exceeded by the amount of damage, then what happens is proteins start to fold improperly, and the folding determines the function of the protein. When they improperly fold, they have a natural tendency to cluster together. And when they do that, they will attach to the cell membrane. And when they attach to the cell membrane, it interferes with the function of the cell, so that if that continues to increase in a cell, it will ultimately kill itself. And that is thought to be the basis of all degenerative diseases, including brain and body. And every time I look, it's interesting that every time I look at a disease, I find that there's a particular set of misfolded proteins associated with that disease. Even things like autism, diabetes, high blood pressure. And so this inflammation is one form of stress to cells. Now, you think about it for a second as, what provides the energy to a cell? Well, you got to make energy called ATP. It's like the ever ready bunny, the Energizer. And one way to make energy for a cell is for blood to deliver the right nutrients. And guess what? Exercise does a great job at that.
Yeah, Molly, one thing I was really struck by in your presentation, how quickly do you see improvements in people that you work with when they, make the necessary changes in their diet, in their sleep, in their exercise routine, in their stress management? What is the impact that you see?
Yeah, so I can share with you another trial that I am coaching now. It's called the prevention trial, and it's at PNI. We do blood markers every 3 months. So we can see improvements in 3 months if people really are on board with the recommendations.
Yeah, in fact,
Wow.
uh, I lost 10 to 15 pounds after working with Molly for 3 months. And it's just, I didn't really change my exercise. I mostly changed my diet.
Wow. What Molly, what is the role of the caregiver in lifestyle intervention for, a loved one who has dementia or mild cognitive impairment or what have you?
Yeah. So it really depends. If someone has a later stage dementia, I might be referring them to memory care. And that's something I actually can work with individuals on if they're interested in that. So they typically need the support of a caregiver, even to connect with me on Zoom, right? Or if we talk about doing any sort of homework, they're going to need that facilitated by another person. However, there are people with MCI who may just work with me on their own. I mean, I have lots of clients like that. There are also people that I work with who may not need their spouse or anyone else to be part of it, but they really want them to, because change is more successful when people do it together. So there's a lot of variety there.
In
Molly,
what oh, go for it, Dr. Shankle.
and by the way, just so people know, if you can access the chat box, Christopher has provided information that may be useful from this webinar. No, I forgot what I was going to ask.
So I do see some questions in the Q&A.
Good. Go ahead.
Oh, I did. Can I quickly ask one more question, Molly, before we
Sure.
turn those over? I'm 33 years old, gonna turn 34 this summer. I struggle to stick with various changes in my lifestyle, be it changing my diet or sticking with an exercise routine. And so, I can imagine that, having had a grandfather with Alzheimer's, it's much more challenging for people who do have any cognitive impairment to make some of these changes. What have you both seen has really helped your patients or your clients make some of these changes and make them stick?
Mm-hmm. Well, I do think having social support is really important. So people are much more likely to stick to an exercise routine if they have a trainer that they meet at the gym, or they get involved in a class that they really enjoy, or their spouse goes with them. So I think having support is really important. I also, a lot of my clients tell me, you are in my head. Like they just think about me when they go to make some choices. And they know in 2 weeks, I'm going to ask them, how's you wanted to work on this? How's it going? So I think that accountability can be really helpful as well. And also exploring, like, how do you set yourself up for success? So for instance, everyone's different. You don't have to do it all the same way. But I know for me, if there's foods that I don't want to eat regularly, especially since I work out of my home, I don't buy them. That doesn't mean I don't eat them. I will go out and enjoy something that I might want. Like, let's say I would go out and have a treat of a scoop of gelato or something like that. But I don't want ice cream in my freezer because then I have too much access to it. So what kind of things can we do to make life easy? If you don't like to cook, can we look at some prepared meal services that might help you to have a good balanced meal ready to go instead of doing takeout, things like that.
When you're working with clients, how much commitment and follow through do you need to see in order to see those changes in like the blood biomarkers? Or, if someone were to do partial changes to their lifestyle, does that have a big impact too?
Yeah, that's a great question. So when we look at studies and people do well, it's not that they did anything 100%. we see good outcomes with 75, 80% compliance. So that's one good thing to know. Also, in terms of the COCA trial, we had some real standouts. And I can tell you that most people did not change everything. So I think that whatever changes you can make can be really helpful. I also don't give up on anyone, because I found in the COCO study, since it was 2 years long, there were people, I talked to them about Brain HQ for the first year and they never implemented it until the second, and then they did it every day for a year. So I just think that a lot of people really appreciate the support in their lives. You know, I try just to, you know, every day is a new day. So it's not really about checking everything off the list. I think that would be an impossible wager for most people.
Could you tell us a little more about Brain HQ and just about memory exercises in general?
Sure. So there's a couple different ways to think about this. We have cognitive training, which is really specific to certain domains and can be tailored to people. So for instance, if you have trouble with maybe your hearing or even your kind of processing of audible information, there is specific program for that. Or if you have trouble with speech, you could see a speech language pathologist. Like those are going to be considered cognitive training, because you're directing it at a specific skill set. Brain HQ works with our senses largely. So as we age, our senses decline. And when we have less senses, we're not getting all the stimulation and inputs that we need to keep us really cognitively strong. So Brain HQ is going to work on, you know, hearing sound differences, on your peripheral vision, things like that. So there's another, we tend to recommend Brain HQ because it has the most research behind it, but something like luminosity and DACUM are also good. So that's one thing you could do. However, I mentioned, you know, languages and musical instruments, and there's so many ways to be cognitively stimulated. So that's a conversation that I really like to have with people. And that's another form of kind of experimentation. I have a client now from the Shankle clinic who thought, well, I'm going to go and do piano, and he really didn't like it. So he picked up a different instrument. He's enjoying that much more. So it's really finding the things. Another piece of behavior change is finding something that you enjoy and that you're motivated to continue doing.
Yeah, and also that I think that trying to change behavior, everybody, I think, has trouble changing behavior at any age. But when you throw in some cognitive difficulties into the mix, what becomes more difficult is initiating or making the first step, taking that first step. And I liken it to the activation energy of a nerve cell. The nerve cell doesn't fire a signal until the voltage of the nerve cell changes a certain amount. And when it reaches that amount, it fires automatically, like a yes, no, or a binary event. I think that a lot of times making a change in behavior requires you reach that activation energy. And maybe that's why, you might take a year before you make a change. That buildup may be a lot slower for whatever reasons. And so the more things that you can add in to build up the activation energy to fire and make the change, I think the more likely and the quicker you can make the change. So I think that's where the social support and doing the activity with somebody, or sometimes even getting someone to help you get started. I mean, those things really make a difference.
Absolutely.
Well, should we jump in about 4 or 5 minutes early into the Q&A?
Yeah.
If you guys are ready, I'll start asking questions. one of our first questions, what does a life coach cost? And is it covered by insurance? What would you suggest as far as lifestyle intervention for, an elderly person on a budget? Is it possible to afford a life coach on a budget?
Yeah, so unfortunately, a lot of these preventative kind of services aren't covered. So at this point, our lifestyle program is all private pay. So what I really encourage people to get involved in is some of our cheaper or no cost options. So we've gotten quite a bit of grant funding this year, and we're doing, we're providing education at no cost. And I will always send that information to the Shankle Clinic to be shared. We also do a pretty regular, what we call a brain health booster. And that is an education session that we funded ourselves. It's something just community outreach, so everyone can have access to this information. We've done one on the Mediterranean diet, and we've also done one on the blue zones. And they're a mix of memory techniques along with brain health education. Then I would recommend group classes or, group, like Vital Minds can be done as a group. You could do it individually, but you can also join a group. So my next Vital Minds group starts in July. And that would be a great opportunity. It's the cheapest way to get a part of the coaching. So I really, in terms of Vital Minds, it's a lot of brain health education and you're learning memory techniques. I also have a class that actually Dr. Shankle kind of inspired me to do called Brain Health Optimization. I'll probably be putting another one of those on the calendar sometime this summer. And that basically it's 6 different sessions, and I go over just one of these behavior change areas per session. So we'll talk about sleep for a whole hour. I'll give you all the latest and greatest on sleep and tips to how to make it happen for you. Now, you're not going to get the individualized, support and accountability that I could give in coaching, but you will get a lot of the information. So those are some options. In terms of working with me coaching, some people, and this isn't exactly coaching, but if some people just want to get kind of an assessment of how they're doing and get some recommendations, I do offer a one-time consult for $200. And I provide resources after. And if you sign up for 6 sessions of coaching, that drops down to $150 an hour. So that's $900. But the real deal in all of this, if you really want to jump in and dedicate the time, commit to it, is my rate drops down to $100 if you purchase 12 sessions. So that's a really good deal. And some people use those up in a short period of time, like a quarter. Other people will use a session once a month and they can work with me for a year that way.
I might add, just from personal experience, that the first, after about 3 or 4 sessions, I began to get a pretty good idea about, what my program would look like. And then after that, it becomes more of the frequency of visits is more dependent on how often you need to check in to make sure you keep doing it.
Absolutely. So sometimes to build some traction, meeting every other week is good for 1 or 2, 3 sessions, and then, we can push them out. So I'm very flexible. If you buy a package, you can use it however you want to.
Cool. So one other question that we got was, how, excuse me, how would you design like a lifestyle intervention brain health coaching program for someone who's lost all of their short-term memory? For someone who has some sort of severe neurodegeneration.
Yeah, that would be really tough. I mean, that would definitely need a caregiver involvement, a spouse involvement. But some of the things I use in general to help people are, phone reminders. I just learned about this Hero device where you can put all your supplements and medications into it, and it will dispense them for you and give you a reminder on your phone. So if the person can use their phone, there's a lot of tools these days to help them stay organized. I love activity trackers, and I love to work with people with that kind of information. So that's going to give us information about your activity and your sleep. So that can be really helpful for people to kind of see where they're at in the day by looking at the device on their wrist. So those are some examples.
I
Do you have
also,
anything to add there, Dr. Shankle?
I was thinking, let's see. Oh, yes. Barry Reesberg, who's a professor of neurology and Alzheimer's back east, he had developed a theory called the theory of retrogenesis. And what it basically says is that as a dementing disorder progresses, people's behavior follows the reverse of development. And he had suggested that that could be used as a way to kind of determine the mental age of an individual and then select things that would be appropriate for that age. So, for example, I use the tool that Barry developed called the FAST staging tool. And that tool tells me the approximate age of an individual based on the level of difficulty they have in brain function. I can then say, okay, well, for this particular, let's say this person's age is approximately 12, and they enjoy golf or they enjoy some activity, then pick out of that domain of activity they're interested in, but kind of dumb it down to the right developmental age. And you could imagine going into a children's toy store and, they have, ages 3 to 6, ages blah, blah, blah. That's the kind of thing if you kind of know what a person generally likes and they have a particular mental age because of the severity, you can actually tailor what they like to the level of difficulty that they can do. And generally speaking, people do enjoy that.
Fascinating. So I think we have one more question for you, Molly, I think maybe related to your lecture. Could you explain a little further what executive function is?
Yeah, and I pulled up a slide from my talk today that I'll share. So executive functions happen in your frontal lobe, and we sometimes call that the CEO of your brain. So they're pretty important. They refer to a group of mental skills, as I said, coordinated by your frontal lobe. So they work together to help you achieve goals through organization and regulation. So these help you to think flexibly, plan and organize, manage time and attention. I've also heard there's quite a bit of emotional regulation that comes from your executive skills. So pretty important in terms of your brain health.
And how does like does the executive function deteriorate as the disease gets worse? And how does that impact, compliance or behavioral changes?
Yeah, I mean, it certainly can. So that's why we definitely want to focus on strengthening these kinds of skills. Another thing that I was thinking of around this, how do you, make new behaviors happen with short-term memory issues? One thing that I like to think about is what are things that you're already doing that are just part of your regular routine, and can we tailor something to that? So if you always brush your teeth or you always have your cup of coffee, what can we fit in during those times? I've had a lot of success with people doing their brain HQ while they're drinking their cup of coffee, or taking their supplements while, before they brush their teeth, that kind of thing. And if you need a paper reminder in the beginning, that's fine. But once you have, it's easy to kind of jump on board with that behavior that you already have a good habit around.
Fascinating.
There's another thing this is something we published back in the 1990s, believe it or not. And it was basically a study of what's called procedural learning. And in the study, what we were able to show was that you could take a person who was severely demented. They couldn't even tell you their name. They couldn't speak. And we gave them tasks that either involved a fine motor task like writing or a gross motor task like throwing. And what we found was that people could still learn new procedures, but the difference from a normal individual was that the practice conditions had to be exactly the same every time. And if they were, they showed a learning curve. So just for example, for the gross motor task, we had them tossing a dart or a beanbag at a target, and they either had to change the distance from the target while practicing, or they kept the distance exactly the same, and they did it for the same amount of time, same time of day, same place. And the people where the practice conditions were constant showed a normal learning curve, whereas the people where they changed the practice conditions each time, they never learned. So, you know, what that goes into the idea of when a person has cognitive difficulties, it is hard for them to initiate things on their own. So the more consistent their daily routine, it bypasses the need to remember to do something, and it becomes sort of a procedure. And that allows them to function at a much higher level.
Wow. So we have one question from a caregiver who has been caring for their parents, and you know, their stress level is really high and there's a lot of inflammation going on. What is the number one thing that you guys would suggest for them to relieve stress or manage stress?
I can go.
Well, let me go ahead and say something
Please.
about that. You know, I think the most, I won't say most, I'll just say it's very possible that a caregiver, they are trying to, they may feel guilty if they don't try to do everything. And if they try to do everything, they're going to burn themselves out and get stressed out. If they get the right help, assistance, that can be a tremendous relief. And there's a lot of ways to get that assistance. For example, the adult activity programs, the Huntington Beach Alzheimer's Family Services Center, and there are adult activity programs for persons with cognitive impairment in every city. There's usually more than one. Having the loved one go to one of those programs for 4 to 8 hours a day for so many days a week is a tremendous reduction in the burden and the stress, gives them a chance to do things for themselves as well. So that's, you know, one approach. Another approach is for, you know, people who, let's say, just don't do well in a group like that, is to get some feedback and input from someone who's an expert in sort of management of persons with cognitive impairment. And I've used Jane Mahakian for years, and she's been an enormous help to people who are getting stressed out and really don't know exactly what to do in terms of the care and what they can kind of give to other people to do. So Jane Mahakian or a care manager can be extremely valuable.
Anything to add to that, Molly?
Yeah, well, that's such a great response. And I talked to a stress caregiver today about just taking some time off. And I think that's a lot of what you were talking about, Dr. Schenkel. In terms of all the different evidence-based stress management techniques that are out there, most of my clients really appreciate when I suggest deep breathing because it's free, it doesn't take a lot of time, and it works instantly. So some of the other ways that we can relieve stress, like meditation, really require a certain amount of time doing it before we see benefits. However, if you do 5 repetitions of a deep breathing kind of practice, I really like box breathing, where you inhale for 4, hold it for 4, let it out for 4, pause for 4, very simple. That can give you immediate relief.
Very good.
Another thing that I think is really interesting is to explore, and I know that's probably hard to imagine when you're a stressed out caregiver, but explore what's unique to you in terms of stress management. So for me, taking a little stroll in my vegetable garden and just seeing how things are growing is my number one thing that I do all spring, summer, and fall. It just brings me so much joy, and it's very simple. So I bet there's something in your life that you get joy from, and it'd be great to take some time to do that on a regular basis.
Great answers, guys. So we have a couple of questions related to food and in red wine. So, what foods cause the most inflammation, and what is like the impact of red wine or drinking on inflammation?
Molly,
Okay.
yours.
Huh?
All yours, Molly.
Okay, perfect. So we can start with alcohol. Alcohol is neurotoxic. We used to think that red wine had some great benefits. There's, good reasons to believe that because of some of the nutrients that are in it. However, a lot of the research done on that, now that we've taken a second look, it showed us that we were comparing people who drank to people who didn't drink. And people who drank moderately seemed to do a little bit better. Well, once we took a deep dive and looked at the people who didn't drink, it turned out they didn't drink because they were so unhealthy they couldn't drink. So that wasn't a good comparison. So at this point, I don't tell my clients, to quit drinking red wine. I don't tell anyone to not do anything ever. Because that would probably get in the way of your social life and it would stress you out, right? So it's all about balance. However, I don't want people to think, oh, I should include a glass of wine every night because that's what the Mediterranean diet tells me. I think you'd be better off making alcohol more of a special occasion. This is going to be a debate here, gentlemen.
Not for me.
Okay, so
and then the other part of that
foods.
question, inflammatory food. Yeah,
Let's talk about it. So I mentioned saturated fats and sugar, but there's another kind of elephant in the room, and that's going to be highly processed foods. So avoiding or finding substitutions for doing a lot of exploration around the highly processed foods in your diet and how you can make some changes there is pretty important. You can tell it's a highly processed food if there are a lot of ingredients and you don't recognize what they are. So if you're buying something and there's a short list on the back and there are things you have in your own kitchen, I'd say, go for it, generally speaking. So that's one piece. In terms of saturated fat, if you're not already aware, saturated fats are from animals and also from coconut. So most Americans eat a lot more saturated fats than is recommended. What's good for your heart is good for your brain. So cutting back on these saturated fats can be really helpful. So that's really just looking at how many kind of fatty animal products are you eating. Most Americans get the majority of their saturated fat from cheese. So I broke some hearts this morning with this information. This is really thinking about exploring other fatty, delicious foods. Plant sources would be my suggestion. So can you put avocado on your sandwich instead? Can you have olives as a snack? Can you do a nut butter or a nut sauce, or really exploring that? I want people to have delicious fats in their life. I think that's a great component for brain health, but can we find some that are monounsaturated to replace? And then sugar is a big topic as well. I think of really the whole carb picture. So how many carbs are you getting at a meal? Of course, we want to avoid those added sugars, but there are plenty of healthy meals that are also high in carbohydrates. Breakfast is a culprit there. If you're doing a sweetened yogurt with fruit and granola and orange juice, you're getting a lot of carbs there. Or if you're doing dinner that the base of it is pasta or white rice, right? So not only getting rid of soda and desserts, but also, or limiting, but also looking at your total kind of carbohydrate picture. As we get older, we don't manage our blood sugar as well, unfortunately. And things like diabetes or elevated blood sugars can certainly contribute.
Thank you. Well, we have one last question if you guys are okay staying just a little bit later. What are the health benefits of socializing, and how much does someone need to socialize each week to get those benefits?
Go ahead, Molly.
Okay. So we don't have as much research around social engagement and social health as we do with exercise and nutrition. I could give you, and sleep. I think those are that picture is a lot clearer. However, one of the benefits that I brought up was this cognitive reserve. So this is a resiliency to your brain. We see that from social interactions. We also know that loneliness is associated with dementia. So in terms of how much, I think the quality is going to be more important than the quantity. And different people crave different types of social situations. I mean, you might be someone who craves none, right? So really thinking about, I really start with where people are at. What are your kind of social situations currently? Does that feel like you're living a social life, or do we need to add some things? So if you are home by yourself during the week all day, I would say that's not terribly social. So what can you do differently? We know you get benefits from going to the post office or going out to grab a cup of coffee. I mean, even a casual conversation like that has benefits. For a lot of people, they'll tell me, oh, I want to be in touch with my family or friends more, so we might start there. Can you do a phone call once a week? But then, of course, there's also getting just more involved in your community, volunteering, joining a book club. There's so many ways to amp up your social life.
Awesome.
Maybe I'll just mention just some experiences I've seen. Very often, people who do get isolated, the families will tell me that they seem to come out of it and function so much better when the rest of the family comes over for an event or a holiday or something like that. It's again kind of like raising that level of energy in the brain when you interact with other people. Think about, you have to listen to them. You have to think about a response. All of the kind of the higher level brain functions tend to be activated with social interaction. And if you think about, the experiments and the stories of kids that get sensory deprived and they never develop certain things, social isolation is sensory deprivation. And the brain doesn't do well when you take the input away. The neurons that respond to the input, they start to get smaller and they become less likely to fire. And so the functions of those brain areas involved become less likely to function and need more energy to be activated. So, you could think about it in that way, how social interaction can be very important.
Oh, absolutely. And we know that people who are partnered or have good friendships, tend to do better. And I really appreciate what you say about being interactive. I will joke with my clients that even when you're in a partnership, you kind of know what the person you live with is going to say. So I feel like it's even more of a mental workout to, talk to friends or even strangers, right? Because you don't know what they're going to say. And you're going to have a different response as well.
That's right. That's right. It's been a really
Well,
interesting session today, and I'm very appreciate Molly taking your time and spending time with us today.
Oh, thank you so much for having me. It was really fun. My pleasure.
yeah, thanks so much, guys. And thanks so much, Molly. And for anyone who's still on here, we will send a follow-up email with the YouTube link to this recording if you want to share it with any of your friends and family. We'll also follow up with Molly's contact information if anyone wants to get in touch. It's also in the chat right now if you'd like to take a screenshot or just copy it really quickly. But thank you so much to everyone who's joined. Thank you, Molly, for this fascinating discussion. And thank you, Dr. Shankle, as always, for doing it all. All right,
Good
guys.
night. Thank you.
Take
Bye-bye.
care.
One
All
another.
right, bye.